Hello to all of my Support Fibromyalgia friends. Jumping on here, I'm Melissa Talwar, one of the founders and the executive director for the Support Fibromyalgia Network. I want to do these incrementally, so these broadcasts for you, just to give you an idea of what's going on at the organization. So we just constantly want to create transparency for all of you on what's going on behind the scenes at the Support Fibromyalgia Network. But before I begin with this presentation, I just wanted to check in with everyone. There's a lot going on. There's a lot in the news right now. How are you doing? Please say hello, check in, let us know where you're tuning in from. So I am in Southern California right now. And, I'm just holding on to like what we can and just trying to take breaks. I posted, if you follow me on my personal account, I just posted that we harvested some more pumpkins, and I did get a nice, good carving pumpkin that I was excited about. Perfect for Michael's Carver and Creator show, so he can carve that pumpkin. I was really thrilled about that. So I definitely enjoy sharing that, and definitely go to my personal profile and check it out, the picture, and I even posted a video. If anyone's interested, I can also share on the Support Fibromyalgia Network of me harvesting the pumpkin. So I joke that's as close to CrossFit as I'm probably going to get with pumpkin lifts, but it's been a cool escape despite all the critters invading my garden, and managing all the critters in the garden was just being able to grow some food and getting to grow some pumpkins for the first year in the Warrior Garden. So I'm excited to be able to do that and look forward to growing some more pumpkins in the years to come and get better. I have a small space garden, although it did grow in the last 2 years as I was trying to do more. But for those of you out there, I did start in container gardens or smart pots or those things like the grow bag. So that's how I started growing slowly. And I hope we can have some more presentations on growing your own food as we go throughout the year coming up, especially as fall gardening starts. It's a good way to kind of go outside, get some vitamin D, establish some rapport with nature a little bit more, and then also start to grow your own food and you appreciate it as well. And I know that we can do it as the chronic pain and fibromyalgia patients as well. It's all about starting slow, and hopefully we can enjoy the time with it. But anyone out there, please just say hello. I see a few people tuning in, so thank you so much. It's so great to see everyone watching and stuff like that. We always appreciate it. So please definitely like and share this with other fibromyalgia advocates in the community. We really appreciate the shares and likes, and to gain momentum and let people know that there's an organization really working hard for them out there. And we won't leave people behind. So we appreciate it. And this is another reason why I like to do these presentations periodically, because all of us here at Support Fibro, myself, volunteers, the board members, really appreciate all the donations and stuff that come in for the organization and support the organizational efforts. So we want to be as transparent as we can. And we are currently organizing our 2020 strategic plan. Yes, we start early for the organizational plan because there's a lot to go through when it comes to the fibromyalgia community. So we're beginning the strategic plan for 2020, just making sure. I mean, I start it in January and present it to the board so they can review. And then we go along, and we've been investing in new program initiatives and that you'll see in this presentation. So that's why I always just want to keep communicating with the community, and then that way you know what's going on behind the scenes over here. We're definitely doing a lot on a national level. So that's why it's a lot to take on. So there's a community efforts on local levels, and we're reaching out to a lot more patient advocates on local levels and community levels, but there's a lot of work being done nationally from our side. So I'm going to walk through with this presentation that I've designed, and anyone has any questions as we go through, please don't hesitate to ask, and please reach out if you have other questions or would like to be involved. We really appreciate all of you out there supporting the organization. We got established 501c3 in 2017, so we're coming on with full steam ahead, and we really want to get you the resources that you need, the answers that you need, and the programs that you need into the community. So it's huge for us. So here we go. I'm going to add the presentation and just kind of get started. So feel free to ask any questions as we go along or if there's anything in here. But yes, so welcome to the Support Fibromyalgia Network. So we are for impact organization, nonprofit organization based in Southern California, based in Sierra Madre over here. But we serve everyone at a national level, and we have a lot of people that work with us who are board members and volunteers all around the country. So it's been great. And our founding members were also all around the country as well, and got started with filling in the gaps. This was the goal of the organization from the very beginning. Wanted to fill in the gaps for the fibromyalgia community. That was initially our what we set our sights on, and it turned out that there's a lot of gaps to fill, as many of you know. So a lot of you have some questions and you have needs for what needs to be done in the fibromyalgia community, and we're always hoping and looking forward to hearing from you. So this is where we just came in to inspire a community through education, advocacy, and research. Main focus really was the education component, but we found out because of my love and interest for research that you're going to need an advocacy component thrown in there. I've done some advocacy work before when it came to proclamations and those things, but nothing as to this level of work that we've been doing. So it's a lot, but we're really proud of the work we're doing on a national level, and we're excited because it's new things ahead, new perspective, and I'll walk in through some of the strengths of the organization as well. So just a little bit more, we believe in innovation, technology. I love personally science, math, and technology, and integrating it in and see things very differently when it comes to innovation. I'm also a big believer in mentorship of other people and advocates, and just anyone who needs that mentorship. Just because I've struggled, I've never exactly found a mentor, and I've learned different perspectives on what mentorship is, and building this rapport with other people so we can learn from each other and play off of our strengths. So I have different strengths, other patient advocates have other strengths, and we pull our strengths and come together to build a better community for all of you. So here we have just to reiterate, the science, technology. I have a background in functional medicine, so that's going to be part of the education route as well. We've really accelerated medical education and advocacy, and now we're going to move forward too for increasing efforts in research for fibromyalgia. But the big thing for me, I focus on execution. Taking action is huge. I know I don't talk a whole lot with people. I'm not very much a talker unless you get me talking about science, but I'm all about executing. And so for me, it's really important. I've waited a long time. I was diagnosed with fibromyalgia at 14 years old. In this journey, it's been a very long time waiting by the sidelines, so I'm not going to wait anymore. I tell people this is my bucket list, determination to make the changes that we need now. I've 20 years writing down notes in my notebook if I ever got my health back, what life would look like and what changes I would make. And I've reiterated it. There's a lot of pages. There's stuff that I can't read because I was in so much pain to even write it down. So I'm determined to get this done for all of you, and supporting the advocates out there that are also determined. I don't want you to give up. It's a long fight. It can be a lonely fight. And I know a lot of advocates have always felt like they were on an island. So this is a big component of what we're doing here, is building this community, bringing advocates in from around the world, and even focused a lot across the country right now, to bring them in, know that you're not alone on an island, and let's just build off of our strengths and support the work you're doing, especially those on a local community level, because we need all the support we can get. So that's huge for me when it comes in. So here again, it's just education, advocacy, research on the top level of what we're digging into when it comes to our focus areas. And within each of these categories, there is a lot, and it's changed quite a bit since 2017 of what our initial vision was going to be, because there was a lot of work to be done to get us to different points like you've seen now. So it's important we kind of share this journey with you and continue to share the journey of the organization with you. Some of the highlights for what we really look like under education is patient services. It's really important. We know that the patient community needs these services. So a lot of the things that we started initially was sending out resources to support group members. or other groups and organizations that needed updated resources. So we were sending out books, we were helping them start free small libraries in their support group systems, or to local leaders and advocates that requested it and said, I don't exactly have a support group, but I do have people locally and we're really struggling to get updated resources. Is there anything that you can send us? So we have done and sent a lot of books out initially. I think things might have changed a little bit with the pandemic to request more digital resources, but we're always sending updated resources to people, and especially support groups, because I really value support group leaders. And before we initially began this organization, I went on tour and around the country in 2016 and met with a lot of these leaders and be like, ask them, what do you guys need? Where are you at? And a lot of the support groups invested their own time and money into getting these resources to their fibromyalgia community. And they're putting in a lot of effort. And I was noticing some burnout as well. So again, it's back to how can we support you? Like, what resources are you looking for? So this patient services. We've added more into like an Amazon wish list. So people that want to donate books directly, this gets serviced out to communities. We've branched out recently to service some of the autoimmune support groups that take on an autoimmune condition with fibromyalgia, because we know that fibromyalgia overlaps with a lot of those conditions. So we do get those patient resources out. We're going to continue with our online education resources as we develop new things. As I mentioned, I do want to bring in topics on gardening. We have other topics designed even from health coaches and health providers coming up as well. But if there are education workshops you are interested in hearing more about, please let us know and be happy to find a guest. Or if you are a guest interested in talking about a particular topic, definitely please reach out, because patient services is really at a core, right? We're patient-led and we're serving the patient community when it comes to fibromyalgia. So making sure you have all these updated resources is important, and bringing together what I have from my back knowledge of being in a functional medicine like health coach and being trained with Dr. Terry Walls and Dr. Bredesen. So it's a unique perspective to be able to provide these resources to the community as much as I can. One of the new things for this year and in 2022 for our strategic plan is adding more patient advisor committees. So we've kind of started our search and we've been invite, but we're going to be putting out an application as requested by the board. So these will be critical advisors in the role of the organization and its program, patient advisors, patients from different parts of the country, to give us more input on what's going on locally, possibly start projects with you individually. So all of the meetings that we'll be meeting with quarterly will be a paid stipend for your time as well. We want to give back to the community as much as we can and see how we can work on projects together. So I'm excited. We've already talked to a few patient advocates when it came to this and the invite, and we just wanted to see if the idea was met well. So that's a new thing that we'll be starting this fall, and there'll be an application this fall we'll be reviewing, and then it'll go in for the 2020 strategic year as well. So stay tuned for that. I just actually got some information. So that's my mug with purple hair. I need to get back to that. But I finally got approval this morning, in fact, from a foundation. I had put together a proposal for some group health coaching, which I've been really active in personally in my professional career. I've become a board certified functional medicine health coach, trained with Dr. Terry Walls. I have access to the AIM portal that she has designed, which is absolutely brilliant. But I've also designed some functional medicine coaching for fibromyalgia specifically. So this proposal got sent out, and I've been rewriting the proposal to go to this foundation over and over again because they had a lot of questions. It's very, very new to understand what health coaching is, and especially a group health coaching dynamic. They approved the pilot portion, which is exciting. So that means it's moving forward, and the closer we get to gathering information, this is definitely exciting for me to help with lifestyle and behavior change for fibromyalgia patients out there. Be working together with you right now, small pilot study that we were able to do and get the resources covered for all of you, and it's free. It's unique to what we want to move forward, and we're going to connect the dots to something that I'm going to talk about shortly, which is echo. It was a good relief because this has been something been trying to get through for almost over a year. And with the pandemic, there were a lot of delays. This will just be online. So it's online virtual group health coaching for a small pilot study with the hope that we can get some more information with this. So you're going to be helping build so that eventually our goal is to get some more grant funding from this foundation and more federal funding to cover these means and be able to bring in some other health coaches as well that could help with all of these lifestyle changes. It's based in functional medicine, so you'll learn from that. And I think this is helpful because right now, a lot of you, and if you are out there, please chime in and let me know, feel like you're educating potentially your providers on what fibromyalgia is and what's working for you. So this is a group chat effort of that behavior change and really digging into the functional medicine principles focused on nutrition, sleep, stress management, community relationships. So these group coaching programs will take us into that form and hopefully empower all of you to know what the materials are, get updated information, and also be able to set goals and do those behavior changes that we need, and then also be able to educate your providers. So I'm really excited that the one step forward has happened. Little by little change is happening. So I just have to appreciate those small wins. Definitely focused on higher things. And when you're knee deep into it, it's hard to think about what's actually going on, but celebrating those small wins. So today I'm going to celebrate that small win for all of us too. And you'll find out more information in the fall when it officially launches. There'll be an application process as well. So anyone's interested in that, please let us know. Because this group health coaching is also going to tie into the medical education, which is, again, this is going to be a huge strategic program for 2022 is Project Echo. And with the pandemic, things have slowed down quite a bit, which I've been disappointed with. But we are full steam ahead for Project Echo and medical education with providers. We're looking to get some more expert healthcare providers involved. So throwing it out there into all our social media platforms, if you are a healthcare provider interested in being an expert as part of Project Echo, or just learning more about fibromyalgia and getting CMEs or CEUs, this will be a perfect opportunity. We would love to hear from you. If you are a retired healthcare provider, or especially we love our nurses, if you're a retired nurse and would love to get involved with this project, I really need your help right now in getting some of this curriculum built, because this is the hurdle, right? We want to expand a medical education for fibromyalgia, but we need all this evidence-based research. And so we're digging in through a lot of the research to come up with things that we can allow experts to teach, so we can get that CME and CEU credits to providers. And this is all virtual. It's through Zoom for providers and allied professionals to join, so we can build this whole system, not only of providers, no matter where, especially if it's primary care in rural parts of the country. We're really desperately trying to reach you of who you're taking care of when it comes to fibromyalgia, because this is online. You can do it from your office or your home. You don't have to travel anywhere, and you'll still get the CMEs for attending these sessions. So this is a big thing. It's a big thing for our network of projects of getting those providers the education that they need on fibromyalgia, updated education, consistent education, and then we're going to build those networks around it. We're going to build in mental health professionals can be brought in, health coaching can be brought in, the support groups can be brought in, and other organizations as well, because that way there's a full entire system that patients can tap into, and even medical providers can know that there's that support as well. So this is bigger picture, but very big goal for our strategic plan in 2022. Many of you have seen it, advocacy and action being posted. Definitely change is possible. Shout out to Judy right now. She's posting a comment. She got to go with us for our first in-person Hill Day. Boy, thank you so much for weathering all of that with us. It was the first time we've organized a Capitol Hill Day, and we made it happen in 2019. We went again in 2020, thanks to all the advocates that joined us there. And we're going to continue advocacy training. We're learning as we move along when it comes to this, and we just celebrate all the advocates that have gotten involved. Shout out to my good friends Looms for Lupus and Crystal from the Fibromyalgia Pain Chronicles and Veteran Voices for Fibromyalgia. The A team working behind the scenes, but we've had a lot of new advocates join us in online advocacy this year. We are building that momentum. Things are changing. We're finding our champions, and it was great experience to hear from our representatives because they didn't dismiss fibromyalgia. They were wondering the same thing. Why hasn't there been an increase in investment in fibromyalgia research? So everybody's on board. We're going to still continue to find our champions. So stay tuned shortly for more information on action items that we have coming out from the A team. So you've seen our post from the Fibromyalgia Pain Chronicles. She gave a great update. We shared it. So please continue to like and share this information, because if you're interested in getting involved, these are great programs for you to start with. People love the excitement of online advocacy. You got to do it from home, got to meet. It was quick, it was fast, but it made an impact. So if you're looking to make an impact in the fibromyalgia community, this is a huge area that we would appreciate more advocates in. If you're friends with your local representatives or even your mayor and all this stuff that we do with proclamations and all those things, we need as many patients involved around the country. So keep your interest coming in. It's not just about doing stuff in May, because we're going to be going back through after the recess in fall, sending those emails. We're going to invite some of the advocates in from particular states where we had a lot of impact with our senators. We're going to be coming back to it. So it's year round. We can't stop. We have fibromyalgia 365 days of the year. So this fight continues all year round. Another area I'm super excited for research. I am a science nerd. I can talk about science all day long if you get me started. So what we are doing with our programs is reaching out to a lot of the researchers and people making an impact in fibromyalgia research. It is out there. There are people. We're gonna do interviews with scientists from the NIH as well as independent researchers. So this is going to be a huge component, because I think people in the past have donated towards research, or they want to donate more towards research. But now I want to connect the dots and actually connect you to the actual researchers doing the work. If there's something that you vibe with, maybe this is something that you share more or campaign for, I want to make it accessible, and I want you to actually see the end results. And I think this is a big part of maybe something we haven't seen in the past, because a lot of people said they're donating to research, and I never knew what happened after that, right? So did stuff get published? Like, what is going on? So again, transparency needs to happen in the fibromyalgia community. So there are passionate researchers out there who really want to focus on fibromyalgia. Let's rally behind them and support them. We're going to be talking to other people who may not necessarily be researching fibromyalgia specifically, but my hope is to get them excited. Maybe they're doing something related to brain research, microglial activation and that kind of stuff. So I want to rally them over to our side and be like, look, with fibromyalgia, let's get some brain health research. Let's get some more research on the microbiome, all of this. So we're going to really bring it in, connect the dots. I'm going to have a lot of fun doing these interviews. I'm probably way too excited to start interviewing with the scientists. And I hope they're okay with it too. I know some have been a little apprehensive or very confused because they're not used to it. So I welcome anyone who's out there right now too, doing surveys or other research. And this can also be in different areas too, because we've had a food accessibility research survey that we're conducting. So it's just different things. And we invite everyone to the table, anyone that's interested in exploring more and asking questions about fibromyalgia. We are here to support you all the way. We are also diving into more technology. So I love integration of technology. So mobile apps, what works best? What do you guys like to work in? Is it notepad and paper for tracking of symptoms, or you prefer a mobile app? Going to be working more in Esri's geospatial mapping systems to create more accessibility for the community on a whole and create story maps around it so we can present to more stakeholders and tell people, look, there's a significant demand in these particular areas of services for fibromyalgia. So let's address it. And I'm hoping this will also accelerate collaboration with other organizations in chronic pain, especially because I know that there's a need for more accessibility and breaking down the services. It's all about collaboration when it comes to Support Fibromyalgia Network. We love it. That's why it's huge when we have our community collaboration. We reach out to a lot of different organizations, support group leaders, and patient advocates. We got to collaborate together because this is how we move things forward. It's a team effort. I can't do this all on my own. Even if it was just me and the board, we can't do this all on our own. So it's going to take a lot of work for us to come together and create something new for fibromyalgia and create the change that all of you have been asking for. So we do a lot of community collaboration. You can see it's the lovely team of Estella and Juana here. But we've been doing collaboration with the Veteran Voices for Fibromyalgia, the Fibromyalgia Pain Chronicles, Long COVID Alliance. That's just to name a few. We have some other stuff going on with Crowning Lupus, which I'm excited about in South Carolina, and some other organizations too in Michigan. We love collaboration with patient advocates, Butterfly Chat, Painfully Living, That Gaming Dad, just reaching out to the community as much as we can. And we're going to get things done. I promise all of you. I know there's a lot of people out there that have waited a long time, just like I have. I mean, this is 20 plus years of a journey for myself. I am not going to let you down. I have one focus when I go to bed and I wake up in the morning. It is about these changes for the fibromyalgia community. So if there's something on your mind, if there's something you need to share or something you're noticing within your local community that you want to get done for fibromyalgia, don't hesitate to reach out. We are working on this strategic plan that continues to move forward in 2022. We don't stop. We appreciate all the support. So we understand, like with donations, it's difficult. That's why we're looking for other grants. And I'm always constantly writing grants and submitting proposals. But we appreciate any donations that come into the organization. We are very, very grateful. And we also appreciate shares and likes for all of our content. And please let people know that Support Fibro is actively making changes, actively being out there. I know we've switched to a virtual world with the pandemic. We used to go out there on tour and we used to set up events in person. So we aren't able to do that right now, but I'm loving these virtual workshops and virtual connections because we get to connect with more people all the time, which is perfect. And you can be at home connecting with us, and we still make a huge difference in the community. We are learning a lot. So please continue to share with your other fibro warriors, bring them in to the fold, and we'll be working together. So reach out anything that you need. Thank you so much for your time and understanding more about our organizational network. If you ever have any questions, I am happy to answer them. Please connect with me on my personal Facebook account. It's Melissa Nerdy Talwar, so you can see the pumpkin harvesting and the things I do in the garden, but you can also send me a personal message there. Happy to answer. I do try to set up meetings frequently, so I'm going to open up my Acuity calendar as well, so you can book direct meetings with me. I have them quite frequently with a lot of advocates. I love it, and I know it's sometimes strange for people because I'll reach out, be like, hey, here's my schedule, book a meeting with me, and we'll have a one-to-one virtual conversation, catching up, see how you're doing, what resources you need. I'm all about that as much as I can do. But I'm going to be opening up more time on specific days as well, now that my schedule has opened up even more. I just love connecting with people. I want to know what's going on with you. How can we support you? So that's huge. What can we do to help? How can we support you? So don't hesitate to reach out. Thank you, everyone. Please have a wonderful week. I don't know if I'll be checking in, when I'll be checking in next, but there's a lot of stuff coming through this week that I need to take care of, including that final proposal too for the group health coaching, which I'm excited about. So stay tuned for more updates, and I will talk to you later. Bye.